Welcome. Today, we delve into the world of genetic disorders, focusing on progressive familial intrahepatic cholestasis, or PFIC. This is a group of rare inherited conditions that primarily affect children. PFIC is characterized by the disruption of bile formation, which is crucial for digestion and the removal of waste substances from the body. The mutations in genes related to bile formation give rise to three types of PFIC, each with its own unique characteristics. Understanding PFIC is the first step. Now let's examine how doctors diagnose this disorder. Diagnosing PFIC involves a series of tests. The journey to a correct diagnosis can be a complex one, involving an array of medical procedures. Initial steps often include blood tests checking for abnormalities in liver function. These tests can reveal elevated levels of bilirubin and liver enzymes, common indicators of PFIC. Next, liver function tests can provide more detailed information about how the liver is performing its essential tasks. These tests measure the levels of proteins, liver enzymes, and bilirubin in your blood to determine if your liver is damaged or inflamed. However, these tests alone cannot confirm a PFIC diagnosis. For a definitive diagnosis, genetic testing is typically required. This test looks for mutations in certain genes that are known to cause PFIC. It's a critical step in the diagnostic process, helping physicians to pinpoint the exact type of PFIC a patient has. Early diagnosis is crucial in managing PFICC. The sooner the condition is identified, the sooner treatment can begin, potentially slowing the progression of the disease and improving the patient's quality of life. With a diagnosis in hand, the next step is to understand the signs and symptoms of PFIC. PFIC manifests through several symptoms. The condition often presents itself through clinical signs such as cholestasis, a condition where bile cannot flow from the liver to the duodenum. Another common symptom is pruritus, an intense itching sensation that can occur across the body. Jaundice, which is a yellowing of the skin and eyes due to high bilirubin levels, is also frequently observed. It's crucial to understand that this disease tends to progress rapidly, often leading to liver fibrosis and end-stage liver disease before adulthood. Now that we've discussed the signs and symptoms, let's look at the epidemiology of PFIC. PFIC is a rare disorder. When we talk about how often this condition occurs, we're delving into what's known as incidence rate. For progressive familial intrahepatic cholestasis, or PFIC, the estimated incidence is quite low, falling between 1 in 50,000 to 1 in 100,000 births. This means that for every 50,000 to 100,000 babies born, one might be diagnosed with PFIC. Having understood the incidence rate, our next focus is the male to female ratio. PFIC does not discriminate based on gender. It's a condition that affects both males and females equally. This means whether you're a boy or a girl, the odds are the same. The male to female ratio is balanced, standing at a 1-to-1 ratio. This just goes to show how unbiased nature can be when it comes to certain health conditions like PFIC. With the gender distribution clarified, let's move on to discuss survival rates. Survival in PFIC is a complex topic. It's influenced by a variety of factors, from the severity of the disease to the specific type of PFIC a patient has. Treatments available also play a crucial role in survival. Ursodeoxycholic acid therapy, for instance, can help manage symptoms and slow disease progression. For some, liver transplantation may be a life-saving option, offering a beacon of hope in the face of a challenging diagnosis. Survival rates vary, but hope prevails, with advancements in medical treatments. In conclusion, PFIC is a complex genetic disorder with a significant impact on those affected. It's a group of autosomal recessive disorders that impede bile formation in children, leading to symptoms like cholestasis, pruritus, and jaundice. Diagnosis involves a range of tests, while management can include ursodeoxycholic acid therapy and potentially liver transplantation. The incidence rate falls between 1 in 50,000 to 1 in 100,000 births, with no clear gender preference. Survival is greatly impacted, with liver fibrosis and end-stage liver disease often occurring before adulthood. Remember, knowledge is power. Understanding PFIC is a step towards better management and potential future treatments. Like, share, and subscribe.